Quality checklist for consent form. In the consent form, what and all needs to be there? Patient identification, patient name, patient EHID, patient age and sex, and patient location should be there. Procedure details should be explained in the language patient understand. Correct procedure name should be written. Side and site should be mentioned, left or right side. Date and time of the procedure should be written. Name of the treating doctor or any more doctor if involved in that same treatment, that also needs to be written. Procedure related risks to be written, any common risk or any specific risk, any complications, any common complications or any specific complication also needs to be written. Alternative to the treatment also should be explained to the patient. Benefits also needs to be explained to the patient. If during treatment if any other procedure needs to be done, that also needs to be explained to the patient. After explanation, and patient should be explained whatever the language they understand, and that should be mentioned. Patient has explained in the language English or Kannada or Hindi or Tamil, Telugu, any language, that should be written properly in the consent form, otherwise consent form will be invalid. Patient signature should be there with date and time. Surrogate signature, if surrogate is signed, patient is not competent, then reason should be written why the patient is not able to sign, why the surrogate is signing. So that also space should be there to write the reason and to sign the surrogate. Treating doctor should sign with date and time. Patient also should sign with date and time. Surrogate signature also date and time. Treating doctor also date and time. Without date and time, signatures are also invalid, because if you are not writing the date and time of taken the consent, then when the consent has been taken, then the consent will come as a invalid. So these are the points which is required in the consent form, and this will is the requirement of NABH accreditation also. If you are qualifying all these things in your consent form, then you will not get one single NC in your consent form. Thank you.